Good afternoon. Thank you for joining us for this special live stream conversation. My name is Andrew Brown, and I have the pleasure of serving as the director of the Center for Families and Children at the Texas Public Policy Foundation. The COVID-19 pandemic has touched all of our lives and has particularly impacted children in foster care and their families. As the state's child welfare system has worked to adapt, local communities are stepping up to find innovative ways to continue to meet the unique needs of kids in care. Today, we'll be sharing a few stories of how ordinary Texans are coming together to support some of our most vulnerable neighbors. I'm honored to introduce two leaders who are on the front lines of these efforts. Katie Olse is the CEO of the Texas Alliance of Child and Family Services, which represents local private and nonprofit organizations throughout the state that serve children and families who have contact with the child welfare system. Dr. Wayne Carson is the CEO of ACH Child and Family Services, a nonprofit organization based in Fort Worth that's responsible for managing the foster care system in Tarrant and the surrounding counties. Dr. Carson and ACH have been at the forefront of reforms designed to shift the focus of foster care in Texas from the state level to the local level. Katie and Wayne, thank you all so much for being with us today.
Thanks for having us.
Welcome.
Now, before we get into some of the exciting work that's happening, I'd like to set the stage with a little bit of context about how the COVID-19 pandemic has impacted kids in foster care and their families, especially in the early days as the system was forced to quickly recalibrate.
Well, sure. I'm happy to start with that. And thanks, Andrew, and thanks, TPPF, for hosting this session today and for having us. I think the most immediate impact has been with regard to social distancing. For children in the foster care system and for their foster parents, we strive to keep them very connected to each other, connected to their agency, to their support system, to their families, to professionals working as part of the family team, and so many more. Going to school, going to extracurricular events, having visits with their siblings, going to the mall and part-time jobs, having friends over. These are all activities that giving up for most of us may seem to be more of an inconvenience, but for children in the foster care system, they actually provide normalcy in an otherwise very not normal life. And I think for group care settings, such as kids that are in children's shelters or residential treatment centers, reliant on staff and volunteers to help make sure that children are well cared for and served. And these are typically kids with more unique or more intensive therapeutic needs. So it's really important that there's minimal disruption to their care. But now so many more precautions have to be taken before visitors are allowed and staff and caregivers take on shifts. So there's a lot more screening and staff that are having to stay longer shifts to avoid frequent coming and going or risking exposure. So just a whole new normal for us right now.
Yeah, and one of the hard parts for us in the beginning was just that fear of the unknown. I mean, we have a group of people that very much care about their children. They care about the safety of their children. They care about doing everything they can to protect their kiddos. And so when this first started, it was there was a lot we didn't know about it. It was kind of this really scary thing that was taking down a lot of people and was spreading really quickly, and we didn't know what was happening and what was causing it and what to do about it. And so the need for good information, the changing information all the time, just kind of created initially a lot of just concerns about what do I do to keep my kids safe, because that's what everybody wants to have happen.
Right, and one of the things that came up and that impressed me early on was as the system was really adjusting in real time to new reports, one thing that TPPF and some other family advocates noticed was we were seeing and hearing that in-person visits between parents and children were being canceled, important decisions about permanency and reunification were being delayed. And that was something that we called attention to, and I was really impressed by how quickly DFPS, the Children's Commission, courts, the whole system itself really quickly recalibrated and issued updated guidance to prioritize that contact between children and their families, as well as moving forward with returning kids home who could go home if it's safe. So this brings up an interesting question about the view of the child welfare system, the way that we practice, that we're going to have to be addressing, I think, in the months to come. And I'm interested in some of your initial thoughts on whether we'll see some fundamental changes to our underlying ideas about the system and changes to our practice as a result of what we've experienced over the last few months.
Well, I definitely think we will.
I'll start with that one, Katie.
Okay, sorry.
Go ahead.
Sure. Well, one thing I think anyone in child welfare will tell you is that we're really adept at adapting. We modify our interventions and our services to a more virtual platform. And just like we're all listening to the front line in the healthcare industry, we're closely listening to the front line in child welfare. These community-based organizations across the state that provide the day-to-day services for children and youth and families in the child welfare system, they know what's needed. And I completely agree that maintaining family connections was an immediate priority for many. And I'd offer that foster care organizations were the first to jump in with proposed solutions to how to maintain these essential connections. Even before the state officially provided guidance to allow for waivers for face-to-face visits, community-based organizations were developing really creative ideas around how to ensure children remain connected with their families. I've heard about foster care agencies providing tablets and technology to ensure that parents and kids can stay connected. I've heard of foster parents kind of seizing the opportunity to offer more developmentally appropriate ways of keeping mom and kids connected. For example, a once-a-week visit in a CPS office isn't always conducive for certain kids or certain families. So what about a toddler being able to say goodnight every night to their mom over FaceTime, and maybe even mom reading a story every night, kinds of things, and more frequently forced to figure it out. And there's just a lot of really exciting creative work underway that I am hopeful will be able to sort of stick and last as we get past this immediate crisis.
Yeah, I completely agree with that. I think there was certainly a lot of heartburn about kids not seeing their families in person, because we know how critical that contact is. We know that's what our kids talk about all the time, is seeing their families. And so how could we make that happen and still keep people safe? And I agree with what Katie said. I think there are going to be some long-term changes to how we maintain contact between kids and families because of this, so that 2 hour visit once a week is great face-to-face contact, but we're learning a lot about those little short phone calls and how was school today and good night and let's read a story together. Those kinds of things that can safely be done virtually and maintain a much more frequent type of relationship between kids and families that is much more natural.
That's great. And I think we can come back to that conversation a little bit later on about practical steps forward. And again, this is a conversation that I can really see developing in the months to come as we look back on what we've all been through together and can make positive changes for the good of kids and their families. I want to shift gears and spend the bulk of our time now focusing on the good things that have been happening organically in communities all across Texas. By far, some of the most inspiring stories that I've been hearing over the last month are those of individuals and communities who are stepping up, often at the risk of their own health and convenience, to meet the needs of children and families. These stories of inspiration and hope, I think, is what a lot of us really need right now. And it's no surprise that we see these coming up in the child welfare context out of just the local communities here in Texas that you all are plugged in with on the front lines. So Katie, your organization, TACFS, represents private and nonprofit service providers across the state. What are some examples of how your members are finding innovative ways to serve their neighbors?
Yeah, I mean, community-based organizations exist to serve, right? They exist to serve in their communities, and they have different missions, and they serve in different ways across the full kind of continuum, but they are traditionally beholden to state contracts and regulations and mainstream. Some of those constraints program maybe not preservation.
Well, a little bit of technical difficulty there with the audio. Wayne, I want to switch over to you. On March 2nd, ACH Child and Family Services officially entered stage 2 of the rollout of community-based care, that new localized model of foster care that we talked about earlier. Before we get into some specific stories of how your region is innovating and responding, can you give us a little bit of an update about what happens under stage 2 and how that transition is going?
Yes, stage 2 is a very exciting addition to the original community-based care model. As the original model was focused on us providing care for the children, which is such an important part of child welfare, obviously. But you know, we all know that foster care is designed to be a temporary solution until kids can get into a permanent family. And so the stage 2 provides the addition of the permanency work to what we're doing. And it's just a really exciting opportunity to integrate what's happening with families and what's happening with kids in a way that we can really focus on achieving high quality, safe permanency as quickly as possible. So it's exciting. Would not have chosen to start it in the same month that a pandemic hits if I would have had the choice, but we're a month into it and we're doing well. We've got staff have all transferred, everybody's up and running, they have caseloads, we're not missing meetings, we're staying in contact with our kids and our families. So we're certainly brand new at it still. We're a month in, but we're doing well and we're excited about the workforce that's joined us. There's just been some fantastic folks that are experienced in doing permanency work that are part of us. The communication that we've had with our court systems has been fantastic in this time where judges are making very difficult decisions about family visitations and what are they going to do about court visits, and you know, making that decision about maybe delaying something because of social distancing, but helping kids get back home as quickly as possible. So our team has had amazing communication with each one of our judges and is coordinating that work really well. So we're off and running and we're excited, and it's going to continue to get better.
So March was already going to be a busy month for you with or without this COVID-19 pandemic. And during some of our conversations over the past few weeks, I've been really impressed by how well you've balanced those two stressors, one that there was no way for you to have foreseen. Will you give us a few examples about how ACH has been able to pivot very quickly, and some specific things that you and your community partners have been doing to ensure that the needs of children and their families continue to be met?
Yeah, you know, it's going to be really fun to look back on this at some point once we're over with it. The number one thing that's happened is our staff have just stepped up amazingly. I mean, they have taken to the task. They know that, you know, we can't do what the sports teams have done and cancel our seasons, and we can't just close. We need to be here, and we need to be open, and we need to be ready and able to serve kids. And all of our folks know that and have just done an amazing job of continuing to do what we do every day. I do think, you know, your reference to the beauty of community-based care is this has been a time where we have needed to lean on the community to help us. And we've gotten just great response because we know each other and we know that these are our kids and this is our community. So some specific examples, as I mentioned, one of the challenges early on was lack of information. And so we did a lot of our own research, but knowing that some of this information is very specific information about healthcare and about managing disease, and a credible source for that information is the medical community. And so we reached out to Cook Children's Hospital and said, do you have some expertise that we could borrow to help us educate our providers about what to do about this, and what do we know about this virus, and how can we protect ourselves from it? And so, getting access to experienced medical doctors that can communicate directly with our staff and with our provider network has been incredible. In thinking through, what do we do when we do start getting children that are showing symptoms or actually are diagnosed, getting the personal protective equipment available for our staff and our foster parents was a challenge. It was very difficult to find some of that equipment. And so we reached out to the community and had a local hospital that added to an order for some masks for us, knowing that if our kids can't get good care, they're going to end up in the emergency room. And so letting us tag team with them on an order. Our order was very small compared to the order they needed for the hospital, but it's going to allow us to provide that equipment needed to care for our kids. Health authority who have agreed to provide some training on, how do you use a mask, and how do you use a gown, and how do you dispose of them, and how do you put them on correctly. And so that's just been just what community-based care is about. Is we reached out to our community, asked for help, and we got it, and we're still continuing to receive it.
Well, that's wonderful news. And Katie, we had a little bit of audio issue earlier, so I want to come back to you. Just want to hear some of the good news that you've heard coming out of the communities and other ways that you've seen Texans go above and beyond the call of duty to help these kids. All right. We've got a few questions that are coming in while we're waiting for the technology issue to work itself out. We're sorry about that. One way you might be able to handle this is from a newly licensed foster family. How do we know that kids coming into care are free of COVID-19?
So you don't. We can take a strong effort to understand, have they been exposed? So there's certainly some screening tools that are in place now that are asking, have you been around folks in your family that have been running a fever? Have you been exposed, or have you traveled to high-risk areas? But, we don't. The thing we do know, though, is we have a lot of information now about how to protect ourselves from the spread of this disease. We know that it transfers through physical touch. We know that if we keep our hand, and we know that touch, if it gets on our hands, it doesn't get into us unless we touch our mouths or touch a mucous membrane. And so just the importance of keeping our hands clean, keeping our mouths clean, and looking for things that we can do to mainly cleanliness, not touching our faces, and helping kids understand the importance of washing hands too. So there's no guaranteed way to know that there's not been exposure, but there are a lot of things we can do to protect against it from spreading, and then to, obviously, if we do see signs of fever, shortness of breath, getting medical attention right away.
All right, we appreciate that, and it sounds like you all are doing everything within your power to protect the kids who are coming into care, as well as the foster families who are so generously opening their homes, especially during this time of uncertainty.
One other point to add.
Time to charm. We're popping back to you. Want to know a little bit more about some of the good news that you've heard coming out of communities, the way Texans are stepping up to help their neighbors. All right, third time, clearly not a charm. This is a new world for all of us, and technology is a fickle friend. Wayne, we've got some other questions. People are interested on how they can get more involved with ACH and within their communities to serve kids and families who have contact with the child welfare system.
Yeah, that's an interesting question right now because we typically have a whole bunch of volunteer opportunities for people. Our volunteer program is pretty much shut down right now in the sense of we really do need to limit the public exposure to our programs and our staff. But looking a month or two down the road, there are lots and lots of things folks can do. One of the ways you can help right now is there are lots of additional costs to dealing with COVID in the sense of cleaning supplies and getting masks for our staff and looking at ways to maybe provide some additional pay to staff that are willing to work with kids that may be showing symptoms or having signs. So, obviously financial support's always important, but there are lots of ways that you can help, and not just with ACH. I mean, we have great volunteer opportunities for folks to cook meals for our staff and our kids and support our kids for birthdays and graduations. But the cool thing about community-based care is there are lots of other ways to get involved as well. We have a really active child advocacy center. We have a very strong CASA program. We have all of our schools have outreach programs. So lots of ways to help kids in the community, but certainly directly with kids in the foster care system. And then one way that you can really help is consider being a foster parent or consider being an adoptive parent. We are always looking for great families that are willing to open their homes to our kids and share some of the love and strength that we have as a family to help our kids heal from this trauma and be able to, either return home or find a forever family.
Well, that's wonderful. And we surely do hope that folks watching this will find ways to get involved and to give back, whether right now or once the pandemic has passed. We definitely need your support for families across the state. I'm hearing from my crack production team who are working furiously behind the scenes that we have Katie Olse back on the line. Katie, before we wrap this thing up, would love to hear one or two inspiring stories that you've heard of people stepping up to help their neighbors.
Oh, yeah. There's so many stories, and I think Wayne touched on this from what I could hear, but what's happening is just local organizations are just being, just able to say exactly what they need. They're receiving all kinds of help. They're adapting their services. They're just really quick to figure out how they can help and how they can change to meet the need. They're also making sure there's minimal disruption for kids, that kids are realizing educational needs are being met, their health and safety needs are being met. It's a creative time, and we're all doing the best we can. If you will, community-based child welfare organization. One thing to consider right now is really just sort of financial or gift cards. A lot of folks are so generous with donating items, toys, bikes, books, and things like that, clothes. Right now, it's a difficult time to receive those unless they're brand new. And some of the things that they need right now are cleaning supplies and other things. So just consider donating if you want to help, just gift cards or funding right now.
Well, that's great advice. Before we wrap this up, any closing thoughts for either of you? Obviously, there's a lot of great work going on and there's more to be done ahead. And so I look forward to hearing more about what you're doing, Wayne, Katie, what your members are doing, and working together with you to improve the child welfare system in this state to make it more responsive to the needs of kids. Any other concluding thoughts from either of you?
I would just say that we're going to be excited to work with you, Andrew, to assess what worked really well. How are we able to serve families during this crisis that we might want to continue after the crisis is over, and what are some best practices that evolved from this time, and how can we maintain those moving forward?
I agree. I think one of the other areas that we're watching very closely is how this is going to unlock our potential to support families and keep kids out of the foster care system. We know that the economy has impacted our kinship families that are supporting their grandchildren and their nieces and their nephews. And we are 100% committed to helping them through this. And so we're paying rent for some people and paying utilities for some people. And, it's brought the crisis to help us understand that. But that's a small price to pay for keeping kids with the family that they are from. And I think we're going to learn more about prevention and family support through what we're seeing because of this.
Mm-hmm.
I definitely agree. Katie, Wayne, thank you so much for taking the time. And most of all, thank you for what you and those that you serve with, the volunteers, the foster families, the frontline caseworkers are doing in the midst of all of this. We really appreciate all of you who tuned in to join us for this conversation. We will have a link to this recording posted online later if you wanted to share it with anyone. And stay tuned. We'll have more live stream events from the Texas Public Policy Foundation coming up in the very near future. Have a great day and stay safe.
Thank you.